All right. Well, hello everyone, and welcome back to today's presentation. Today's CPH session is on community engagement and partnerships, presented by Molly Polverento. So just as we have in the last few sessions, the chat is open for you to interact, talk to your fellow attendees, as well as put any comments you have. If you do have questions, please make sure to put those in the Q&A so we can find them at the end when it's time to answer the questions. So a little bit about our presenter today. Molly is a senior outreach specialist in the Department of Family Medicine at Michigan State University. In this role, she coordinates activities between the department and community partners, including local and state public health departments. Molly serves as the executive manager of the Michigan Association of Prevention Medicine and Public Health Physicians, the statewide association for physicians working in governmental and academic public health. She is also the director of the Department of Family Medicine Residency Network, where she has worked with programs to develop curricular and scholarly projects related to leadership, public health, population health, and community medicine. Prior to coming to MSU, Molly worked in the public health policy, program evaluation, and program management with state-focused nonprofit organizations. She has served in leadership roles with the Michigan Public Health Association, the Ingham County Board of Health, and the American Public Health Association, where she currently serves as their education board. Molly earned her MSED from Higher Education Administration from Illinois State University in 1999, where she focused on the role of volunteerism and student learning in higher education. She earned her CPH from the NBPHE in 2015. So with that, I'd like to turn it over to Molly to begin.
Thank you, Ashley, and good morning, good afternoon, everyone. I was looking as people were signing in, it looked like a lot of East Coast and Midwest folks so far, but just happy to join you today and talk about community engagement and partnerships. As Ashley said, my role here at Michigan State University is working with our external partners, including health systems around the state, local and state public health departments, and where I'm really excited when I get to actually work with some of our community groups. So I'm excited to talk to you about this. I think this is really important work. I look forward to your questions, and we'll do some practice questions at the end, but if anything doesn't make sense, please, we'll use the Q&A at the end. So hopefully we can resolve anything that you're not sure about by the end of the presentation. So, sorry, hold on a second. So today we're going to cover information that feeds into obviously what you're going to be needing to answer the CPH exam coming up. And so under community engagement and partnership, some of those things are around identifying opportunities to partner across sectors and related disciplines, being able to identify and engage key stakeholders for the planning, implementation, and evaluation of health problems, policies, and interventions. And we're going to define some terms here in a minute, but one of those terms really is stakeholders and key stakeholders. So we'll be talking about that here a little bit more. You also should be able to answer questions around how to access and utilize the broader public health system across all sectors to ensure that policies, programs, and resources improve public health. Identify, develop, and manage partnerships with governmental agencies that have the authority over public health responsibilities. You should also be able to answer questions around implementing strategies for collaboration and partnerships among diverse organizations to achieve public health goals. We're going to talk about a couple of different models and theories around collaboration, partnership, and some tools that are out there from different organizations. Be able to answer questions around engaging the community in collective actions and what we mean by collective actions, as well as evaluating the effectiveness of coalitions and partnerships in achieving public health objectives. And again, we're going to talk some of those definitions. What's the difference between coalitions and partnerships? How do they overlap? What are the differences? And thinking about that structure of engagement as you do your work in community engagement. So like I said, today, we're going to go over some key terms and definitions. We'll talk about some theories and models around community engagement and partnerships. We'll look at how you put some of that theory into practice, as well as some strategies for collaborations and partnerships. And then we'll do some practice questions and hopefully have plenty of time for your questions. So first, we're going to talk about key terms and definitions. And really that first one that we need to define is community. It's a term we all use probably every day. If you're working in public health, it is a foundational piece of what we do, but it's how do you define what that community is and who you're working with? And quite often in almost any public health role that I've had, we're talking about multiple communities, and sometimes it's based on place. So are we looking at specific neighborhoods in our community? Are we looking at a whole geographic community? Are we looking at a specific area code or zip code? It can be culture, it can be religion, it can be values. Talk about customs, set of norms, and identity. All of those things can be a characteristic around which a community is formed. So it's really a group of individuals, and quite often it's defined by that community. So it's really hard as somebody who's seeking to work with community to define it. You need to go and find the people, find your partners, find your key stakeholders, but then let them help you to define who that community is, how that community is made up. Traditionally, communities had an in-person aspect to it, but clearly, especially over the last 15 to 20 years, there are virtual communities that pop up every day, and it can be really hard to stay on top of some of those virtual communities. But those can cross state boundaries, they can become international, and so you really have to think about how you define that community, how you define it for your organization, but then how those that you're working with also define the community to make sure there's some agreement. Because if you're not all operating from the same idea of what community you're talking about or wanting to reach, or that you're wanting to work with, it can create just some tension sometimes, or you'll find that there's a misunderstanding about your strategies or maybe how resources might be allocated. So we're going to talk about different levels of engagement. This is kind of the who. I wanted to, and we use these terms sometimes interchangeably. And so I really want to be specific about what the differences are. So your stakeholders are those individuals or organizations who are or who will be affected by the problem that you're seeking to address. So it could be parents of young children if you're talking about vaccination efforts. It could be, but also if you're talking about increasing vaccination rates, you're also talking about your health systems, you're talking about your providers, you're talking about your insurers, you're talking about your schools. They're all stakeholders. They're all going to be affected by efforts to increase vaccination rates in your community. Stakeholders can be individuals or organizations. So it's important to realize that if you want to work with the individuals, you need to be intentional. It can be hard to reach just individuals. Sometimes you really need to work with organizations, but realize those are also going to have different needs and the impact's going to be different. You have collaborators. So your stakeholders are everybody in that community that could be affected. Your collaborators are the ones who you're going to actually work with to make a change, to evaluate what's going on. And they share some of your goals, they share some of your interests, going back, to vaccination. These are people who, yep, we think we need to increase the vaccination rate in our community. We agree with you. We want to work with you. So collaborators are a subset of your stakeholders. And then further down and kind of a subset of your collaborators, most likely, are your partners. And these are individuals or organizations with whom you have a formal agreement to work together towards a shared goal. So it could be that you've created a community advisory board and your partners are those individuals who have said, yep, I am willing to serve, come to one meeting a month, help promote vaccination activities in the community. I've agreed to do this. And with that, then you're agreeing to engage them. You're agreeing to listen to their feedback and advice on the materials that you're producing or the strategies that you're using, but there's an actual agreement of how you're going to work together. So it's not just the people who are like, yep, we're here to support you, we share your goals. It's more of that structure. Now, sometimes, like, let's say you've got a local foundation that supports your work. And so they're providing you with some money. They really are partners because, again, you have a formal agreement of how they're going to use the resources that they're providing you. But partners might be kind of in the background type of partners, like, yep, we support you. We're going to provide you with this. In return, let us know how you spent it or what your success was. But they're really kind of hands off beyond that. So even partnership and collaboration can have different levels of engagement. Some other important concepts and definitions. One that comes up a lot in community engagement work is empowerment, and this idea that through the engagement, community members gain or expand their own power to create change. It really quite often is that community members always have that power, but they're either not provided with opportunities to exercise that power, or they are unsure of the best ways to exercise that power. Or they're not given entry into those places where decisions are made. And so quite often empowerment is helping some of your partners, your community members, open doors, inviting them to come to your Board of Health meetings, inviting them to meet with your county commissioners at the local level, taking them along to meet your state legislators. It's really being a true partner and recognizing their expertise and their experience as being valuable as you're working together on whatever project you're working on. Community capacity is really about building the like I said, the capacity within a community for those community members. So beyond your collaborators and your partners, more broadly, those community members to gain some skills, some social networks, for them to gain access to power through their participation in whatever activities are going on. So a lot of civic engagement kind of community activities help to just provide community members with more confidence, with more knowledge. They now know how to engage their physician when they're, seeking better care. They know how to ask the right questions. They know, what's actually a healthy choice. They know how to advocate for the availability of resources. And so, but that's broader and looking at the whole community. How do we help to build the capacity of the whole community? Participation, again, it's really having community members who are in leadership roles. They are able to build some of those leadership skills, their knowledge around leadership, and the resources that are available more broadly. And by participating, then they're leading and are very involved in the community change. Relevance is so critical, and it's something that we don't talk sometimes, I think, enough about. That it's really our community that is identifying their needs, that are identifying the gaps in resources, that are telling you how they want to share power. Because if it's not relevant for that community, if what you're trying to do isn't something that's really important to them, it's not going to work. You have to have the community members as a partner in the terms of there's a shared power, and you're listening to them. You're not coming in going, hey, I've got this project and we're going to do it and we want you to help. It's coming in and saying, we're seeing, because we have data and we're happy to share the data, that this zip code has some of the lowest vaccination rates in our community, and we're concerned and we want to try to improve our vaccination rates. Is this seen as a problem in the community? Do we know what the barriers are? You start asking those questions, but you're ready to have them say, it's not about vaccination, it's just about healthcare in general, and we don't have access. And so you have to make sure that what you're talking about is relevant, so that you can keep people engaged and they want to work with you. That feeds into issue selection, where our community members participate in, and I would say lead, identifying issues and specific targets for change. And critical consciousness is about community members identifying root causes of problems and thinking about actions to address them. So it may be, and I've been working with some of our maternal child health, and we were talking about vaccinations and lead testing and all of this. And part of what they ran into were people talking about, just it's difficult to get in to see a physician to get this done. But as they talked more about it and were thinking about strategies to help improve access to care, they also realized there's an underlying trust issue in the community that they're working with. And who are the trusted healthcare providers in the community? where are people willing to go for care or unwilling to go for care? And so they're trying to look more at some of those root causes that if they address those, then hopefully they'll see some of the larger change that they want to see. I also want to talk a little bit about different kinds of community engagement outcomes. So we talked a little bit about community development, that's community capacity, but also developing a group identity. You might have, especially if you're just finding community geographically, you might have sub-communities within that, right? And they might not see themselves as part of a community, but they're still facing some similar barriers and challenges. And by sharing resources, if they work together around a problem, they could, they can share resources that have a bigger impact. But how do you develop that group identity? How do you develop some cohesion and consensus? So really thinking about how you develop that community, so it's not just you're all here in the same, 3-mile area, but that there's some other shared characteristics that can help bring everybody together. Community organizing is identifying a problem and mobilizing resources to identify ways to reach goals. And we often hear about community organizing in political context, but it's the same idea around healthcare issues. It feels like not that long ago, but when about 17 years ago in Michigan, when we were working on our smoke-free air laws, there was a lot of community organizing across a whole bunch of different constituencies. But we had an issue and we were mobilizing resources to all work together to achieve those goals. So, if you've got a shared problem across multiple communities, you can bring those communities together to make a difference. Social planning, these models stress problem solving, and rely on expertise, both community expertise, but also some of your expertise as public health professionals as problem solvers. So it's thinking about the people who do the work as the people who can help to solve the problem within our communities. So hopefully you have community members who have identified the problem, who have helped to identify root causes, and then you bring in some expertise to do some social planning around that. Social action is more of a focus on community capacity to solve problems. So social planning has more of an expert role. Social action has much more of a community role as the experts, so that you can make concrete changes. And a lot of the social action are around social injustices, health disparities kind of work. So we're going to talk about some theories and models around community engagement. And these models have some very similar components and in some ways look like a PDSA cycle, whereas the plan, do, plan, do, assess, act, or plan, do, I always forget that. I'm forgetting the thing, but that continuous quality improvement cycle. And it's just this kind of idea that we're going to start working, we're going to develop some norms and some structures, we're going to identify something we want to do, let's evaluate how that turned out. Okay, do we want to keep that going or do we want to try something new? And so you're kind of continuously going through this cycle of how are we working together? Are we successful in reaching our shared outcomes? Do we need to pull other people in? You're always kind of continuously evaluating what's going on in your community engagement. So the community coalition action theory, again, you can start kind of anywhere on here, but usually when it's taught, and usually when we talk about, you start about what's analyzing the problem, using data that you have available, and also then going and seeking data from the community. So if you think about the community health assessment process, this is a lot of what we do, right? We use our data first to start to identify problems, and hopefully we're able to also pull data from partners in our community, whether it's health systems or other community service agencies, but you're all working together to analyze the problem. Once you have that, then you're assessing what are the needs and what are the assets that we have. And it's important in a lot of these models, it's not just what's the problem, but what resources, what assets do we have? So it's thinking about both, because sometimes you may have a huge need, but maybe you don't have the assets available right then to address that need. So then that's an opportunity to say, do we use the limited assets we have to address something else? Or do we need to engage some other people who have the assets that we need? And so that's a key point as you're building a coalition and as you're keeping a coalition going, to always be looking at what do we want, what do we need to do based on the data, and do we have the resources available to help us to do that? Once you've kind of gone through that needs and assets process, think about what actions, and you put a plan in for what actions you're going to do. How is that going to look? Or what evidence-based model, what do we need to look for? That also gets into development, implementing strategies. Do you need to reach some formal agreements with your local homeless agency to be able to do some work around housing? Do you need to work with some local construction companies about doing some lead abatement, and how many people do they have trained? Start planning what your actions, what you think they should be, and then you develop and implement the strategies. That also means you don't have to develop everything on your own. You can go and look at what's been done in other places. You can adopt some evidence-based strategies and put them into practice. And then you have to monitor the outcomes. I am a program evaluator. That's how I first got into public health, was evaluating some programs. And I am a huge advocate for evaluation kind of throughout, and thinking about interim evaluations, so you can identify relatively early on if things are going as you planned. But you want to monitor the outcomes, and then that evaluation data becomes that part of that next round on how you analyze the problem. Are we making a difference in the issue that we wanted to tackle? Are there some unintended consequences that we didn't even think about by addressing this problem? Have other things arisen that now we need to take into account? So there's also the collective impact framework. And the collective impact frameworks are used in times when you have really limited resources. It's a lot of volunteer organizations when they come together to do some work. So you're really relying on some kind of minimal funding, bare bones. We have maybe half paid person kind of thing. And so you use this framework to make sure that activities among all the partners or collaborators are aligned, because the goal is to maximize the impact for those limited resources. So how do we all work together? How do we coordinate our activities to have the most impact? It's important that everybody agrees to a common agenda and to a shared goal, and that there's a way to measure your success. So if it's, doing some work to try to change bus routes. So we had this not too long ago where our local transportation system was trying to change bus routes, and it was going to move one of the bus stops farther away from one of our FQHCs. And so you had quite a few community groups with not a lot of funding, not a lot of money. It was a whole bunch of volunteers who came together and said, we need to advocate for that bus stop staying where it's at. It needs to be as close as possible to the federally qualified health center. We need to show the value of that, the importance of that. We need to make this argument. We need to figure out who to talk to. They had a common agenda. They had shared goals. And what they did was they had a volunteer who set up a Google Doc, like a Google spreadsheet, and they just tracked all the communications they had with local officials, with county officials, with a few of the state officials, to have them try to pull some leverage. But how do we measure the success? How, tracking what meetings they went to, who they talked to. And so they were able to share information through a Google Doc. And it's just really important to think about how you measure success and how you measure how everybody is sticking to that agenda and shared goals. Which feeds into the next point, which this framework relies upon continuous communication among partners and collaborators to make sure that you are maximizing the impact in these situations. But you do have to identify a backbone organization who can provide, whether it's that Google Doc, or provide some daily support to partners and collaborators. If there's, somebody gets asked a question by a decision maker, they can reach out to that partner organization and go, has anybody else been asked this question? I want to make sure I'm giving consistent information. You have to identify kind of that somebody or that group that's going to be the backbone to all of this, and who can maintain everything. So some similar pieces in a collective impact framework, you're still kind of following that process of identifying the problem. What are your needs? What are your assets? What are we going to do? Let's put it into action. How successful are we being? You're still following that model, but in a collective impact framework, you're doing it often with a whole bunch fewer resources. The planned approach to community health is a model that's been around for a little while. It's probably used much more in governmental public health or by governmental public health practitioners, because this one you need to have some more resources than what the collective impact framework relies upon. But the important thing is, while you might have a health department who has the data, has the resources, and has the ability to bring the community and bring partners together, the goals and the actions are determined by the community. So the key characteristic of the patch model is that you have an organization that brings everybody together, but that organization is already identified as the backbone because they're the ones who can bring the resources, they can bring individuals to the table, but they serve only as the backbone and sometimes as the expert, but they're not the ones that are identifying the goals and the actions. That is turned over to those from the community who are really leading that issue identification. The backbone organization makes sure that data is used to identify health problems and make sure that that necessary data is available, and helps to facilitate a process to make sure that everybody's working to get together to identify needs and to prioritize them together. And there's 5 phases of this model. So you have community mobilization. And again, you've got that backbone organization reaching out to the community, engaging them, getting them going. You have data collection and organization organized by that backbone organization. There's a selection of health priorities, an intervention plan and development, and then evaluation. So again, that same kind of model, but with this one, it's really focused on having an organization that has resources that can bring everybody together and mobilize the community. So that's where it's a little bit different. Asset-based community development really has a focus on what are the strengths. So not what do we need necessarily, but it's what do we have? What are the strengths and the resources that we have in our community? And then how do we improve upon those? It's really to mobilize community development through appreciative inquiry. So it's a different kind of mindset, a different approach to how you look at where a community wants to go. And it's done through collaborative action. Again, you have to have different members of the community around the table agreeing to how to move forward. So the process includes you're doing an asset mapping process, quite often by bringing together different parts of the community. And again, it's all in how you define community. Building those relationships with key stakeholders. So it's great if a stakeholder or somebody in the community is like, well, you know, we've got this little neighborhood organization and we meet once a month and we talk about these issues. But if they don't trust you, if they don't have a relationship with you, they might not give you access to that group. So that asset might actually be unavailable to you, even though more broadly it's available to the community. You also, and this feeds into, again, once you have relationships, you can mobilize some of that economic development and information sharing across your community. Then you bring together stakeholders. So it's a lot of individual one-on-one small group kind of communications to build relationships and build trust. And then you bring everybody together. So you can develop a shared vision and plan, and then identify, okay, this is what we have here. What do we need externally? What other outside resources can we bring in to leverage this? And how do we demonstrate the value of what we're putting in and what we're asking of them and how it's going to work together? So again, it starts with really identifying where a community's at, what they already have, and then how does it get built upon to achieve a goal. And then mobilizing for action through planning and partnerships, or the MAP model. I know a lot of our local health departments in Michigan are very familiar with this because they use it. This is a model that has been developed and shared by NACCHO, the National Association of City and County Health Officials, to use in community health assessments. But it's the application of strategic thinking through an interactive process. So it's bringing together your stakeholders, your community, and then through this process, I'm going to show you the diagram in a minute, like being strategic and collecting information, then reflecting on that information and using it to come up with a shared vision. What are our themes? What are our strengths? What do we have? And there are a lot of pieces This is the original map version. Map 2.0 was released, actually, I think late last year. I apologize. I should have made sure that was up to date. But it's made it a little bit simpler because all of this, especially the 4 map assessments that were in the original model, took a lot of time. And it was very intensive for local health departments that were already feeling like they had a whole lot to do. But the idea is you're going to do these assessments about what are your community themes and strengths. So pulling from that asset model, um, what are the local, what's the shape of the local public health system? Who all is involved in the local public health system? Looking at that community health status, so your health indicators, as well as forces of change. What are these other things outside the community that are going to have an impact on what we're able to do within the community? I know when my local community, and as we've been talking about our community health assessment, one of those forces of change is that we have had our health systems, it feels like constantly changing ownership. They're getting bought out by different people. And what does that mean for access to care and their willingness to partner on projects? And some of that loss of local control. A lot of our smaller local hospitals are getting bought up by health systems as they increase their networks. And so there's a lot of concern about what that means, both for a partnership level as well as at a community level for a health indicator. But this model, again, if you go to the NACHO website, there's a ton of information, a ton of great resources on it. But again, it's still the same process of gathering the data, identify the issues, figure out which issues you want to focus on to create your goals and strategies, and then implement it and evaluate it. So again, those are common elements of all of these models of using data to identify needs and assets, come up with a plan, put the plan in motion, and evaluate the plan. I do want to talk really quickly about stages of coalition development, and you'll see this in different places. Some of it's storming, norming, and performing when it talks about bringing groups together. But it really is this idea of how coalitions develop over time. And by time, I mean, it can be years, it can be decades. It depends on how long and the goal that you're trying to achieve. Obviously, formation is when you bring everybody together and everybody's getting to know each other. You're talking through how are we going to work together? Who's going to be that backbone organization? How often do we communicate? How are we going to do this work? It's coming up with your shared vision, your goals, your roles in your coalition. How are we going to do this? That's that formation stage. And that can take some time depending on the resources that are coming into this coalition. If you're lucky enough and you're part of a coalition where there's a person who's funded 100% to do this work for a short time, it might not take as long. If you're working with volunteer organizations where they're fitting this in where they can, it might take a little bit while longer. But that formation stage, it's important to be very intentional during that formation stage and to think through all of these pieces of how we want to do this and how we come together and to build those relationships, because those relationships for the people that are around during those stages and how you bring new people in are really important for the success of the coalition. Maintenance is we've got our processes, we're feeling a little bit established, we know what our goals are, we're putting things into place. Now we're kind of maintaining the work. We're able to meet once a month, get some updates. How is this going? What have changed? Do we have, maybe one of our original members is now no longer in the position with our partner organization. So now we have a new person that's come in. How do we make sure to maintain our activities while you're bringing in new people and people leave? And how do we keep redefining our goals? Maybe we achieved our original goal, but we see there's some others that are related to what we want to do. So how do you keep moving forward, even if your specific goals change a little bit? How do we adjust based on the needs that we're seeing as we do our work? And then institutionalization is really that this coalition is now just kind of almost, I don't want to say this a given, but it's something that everybody expects to continue, that people rely on this as a place to come and get some work done, that it is supported by the organizations that the members belong to, that they represent. Maybe there's some consistent funding and a budget somewhere to help support the activities of the coalition, but it's established. So it's not just maintaining it, but this is an important coalition. This is something that we are going to do. This is part of maybe some of the organizational missions and visions, part of strategic plans. It's become a part of the way of business for these groups that have come together. Not all coalitions get to that stage. Sometimes because they were very dependent on the people that were there in the forming, and when those people are gone, the new people maybe don't have the same focus on it, don't share the same priorities as the original people. Sometimes you've achieved the goal of the coalition and it doesn't make sense for that group to pivot to something else. And so the coalition decides to end its work because it achieved its goals, which is a great thing. But it can be a challenge to get to institutionalization. It can take many years to get to institutionalization, but it is nice when you've got a community coalition that has become institutionalized across a whole bunch of partner organizations, including maybe the one that you work for, because then as new issues come up that are related, you already have a jumping off point to bring kind of an issue of concern to this group and see if it's something they can take on, or maybe they have a way to spin off some smaller groups to do that work. Okay. So we've talked about theories, we've talked about some of that process. So we're going to talk about how you put all of this into practice, and really the who and the how. I will say, and this isn't necessarily on the exam, and I know that's what you're here for, but this work can take a lot of time, and often it's not always appreciated how much time goes into doing community engagement and partnership development and maintenance. So it's just important to realize this isn't easy work. It takes a lot of intention, and it's not something you necessarily move through quickly. So when we talk about putting it into practice, realize some of this can take quite a bit of time. So one of the first things you want to do, let's say you and your colleagues are really concerned about increases in STIs in your community that you're seeing, especially in certain pockets of your community, you're seeing huge increases in STIs. So first thing that you want to do, there's a problem, but you guys can't do it on your own. You have to identify some key stakeholders. And your stakeholders are everybody that's impacted, but your key stakeholders are those people that you can bring to, that you can go to, or that you can bring to your table, who represent parts of the larger stakeholder community. So they might be representatives of specific organizations, of particular subgroups in the community that you need to work with, or constituencies within that community involved. So if you're, looking at STIs, it may be that you have a local health coalition that works specifically with teenagers, and maybe that's part of the population group you're concerned about, is you're seeing some STIs in those who are 16 to 25, so those young adults, and you're really wanting to do some work there. So you might want to bring somebody from that organization to your table, or maybe you have some connections with local school districts that might be able to help identify a student who is interested, ideally somebody who's 18 or over, because when you're working with minors, it gets complicated. But so you have to be careful sometimes, because sometimes you want to do work around kids, and but you can't usually easily have kids at your table. So how do you engage parents, especially around topics that might be challenging for some parents and kids to talk about? You also want to look for those opinion leaders, so those members of the community who are trusted to represent them in a shared effort. They're trusted to be that key stakeholder at a table like this. These individuals are recognized by their community as representing the views of the community, and will also, typically they will be trusted to take messages from the coalition back to the community and help you to engage more broadly and get messages back, and help with the success of any intervention that you decide to do. Different than opinion leaders are gatekeepers, and gatekeepers are people in the community that have a role that allows any kind of formal or informal access. They control some sort of access to the population or to a specific part of the community involved. One of my early positions, I was working with Native American communities, and learned very quickly the importance of the gatekeepers in those communities, and that you needed to have developed trust, which took time, um, with those key leaders in those communities, and for lots of good reasons. There's lots of suspicion. There's lots of questions about why anybody is coming and trying to teach them how to evaluate programs. What else do you want? What are you trying to show? I totally understood and approached it in that way of I'm here to be of assistance however I can. You tell me how I can be of assistance, how my skills can help what you're trying to do. And over time was able to build those relationships, and the gatekeepers were able to feel comfortable allowing me the access to other people in the community that I could work with. Um, but you want to have those, and you want to know who those people are. And hopefully before you're trying to put some work together, a project together, you're already engaging with them to make sure there's some trust, and you have a way to communicate with them, and you can share with them what your concern is, and maybe they can help you and open up the community a little bit more to find some people who can, sit around a table with you and talk to you. Ideally, your key stakeholders in a community will agree to work together for a common goal, but not all key stakeholders are going to agree with each other. And we'll talk about this a little bit later, but there's sometimes community dynamics that you have no control over, you might not even be aware of. And it might be difficult to bring all the key stakeholders to the same table. So you need to keep learning about these relationships and communities that can be quite complicated. And even if they're not all talking to each other, see if you can achieve some agreement on a common goal by working with them individually, so at least you can bring some of those efforts together. Again, in identifying your key stakeholders, the first thing is, what is the problem that you're trying to address? Because your key stakeholders around a transportation issue are going to be different than your key stakeholders around vaccination. There might be some overlap depending on the community that you're working with, but there's probably going to be some different key stakeholders depending on the larger issue. Who is affected by this issue or problem? So I sit on my local school board, and quite often there are things going on in our community that will affect our students or our schools. But we as a district aren't necessarily brought to the table, nor are our parents. It's kind of, there's this disconnect sometimes. So we have a new development going up on the edge of our town, and the people behind the development and our zoning commission really didn't think to do much with the school district as far as what does this mean for our bus routes, and how far outside are we going to have to go, and are there going to be challenges with traffic patterns because we have a decent amount of people who walk and bike to our schools. Are we worried about traffic safety? They kind of did some of that on their own, but hadn't really talked to our transportation people in the district. And so we had to have some conversations after things were already planned and underway. Then we're trying to fix it as we go. So it's important to think about who's affected, not just who are the people you always talk to. Who's already working on this issue? Are there existing groups you can partner with or join with? You don't have to be the one that starts a coalition. Sometimes it may be, I'm really interested in this. Is there anybody else doing it? And can I introduce myself to them and ask if I can help? What types of changes are needed? So depending on what type of change you think is needed can also shape who your stakeholders are. So if you think it's a policy change at the state level that really needs to change so that you can make improvements in your community, then it's good to have a legislative aide, maybe who's one of your key stakeholders, or somebody who's working in that area, maybe a lobbyist for a group. Somebody who knows that process and can help the other stakeholders around the table walk through it. And then who are the stakeholders not currently involved in solving the problem, but can help make the needed changes? So always looking around the table, who's not here right now, who's not currently involved. Maybe they were invited and weren't interested in the past. Can we go back to them and reapproach them now that we've done some work? Maybe they'll be interested. You always have to think about who else might be affected and might be willing to work with us. Keep in mind, you always want to think about the resources or the assets that stakeholders have access to that can help to address the problem. And you need to be careful, and this gets into a couple of the other keep in minds. that a lack of resources or assets doesn't mean that they can't help to address the problem. They might just have, it may just be that their assets are, they know the right people. And that may be very intangible, and maybe it's hard to quantify, but don't just look at physical, monetary resources or assets or expertise. Sometimes it's just knowing the right person, or somebody who's got the history and knows what's been tried before and what didn't work, because that helps you to understand how ideas might be embraced or not in a community. It's important to think about the financial and political implications of working with identified stakeholders, and what are those unintended consequences of people working together. If your area is anything like mine can be, you often have groups that are working in the same area, but they don't always work well together, or they've arisen kind of in different ways, serving slightly different communities. And you just have to be aware of those dynamics, and understand that there can be real impacts for groups working with quote unquote the wrong partners. And some of that comes back to funding, some of that comes back to just historical barriers, historical disagreements. And so just think through what some of those consequences. Always be transparent with your partners about who else you're working with, so that they understand and they're not blindsided and feeling like, why are you working with those individuals? When I mentioned I worked with Native American communities, and we were helping them to evaluate juvenile delinquency prevention programs. And one of the communities, their tribal police force and their tribal community, their Native American community in general, had a very antagonistic relationship towards the non-Native police force in the community. And there was a lot of finger pointing about why and who and how. And although we would have liked to have been able to help also work with the non-Native police force to understand some of their perceptions of juvenile delinquency in the community, and maybe what some prevention opportunities might be, the historical divide was too great, and it would have damaged our ability to work with our Native American partners if we had tried to do that. So it was very much understanding that relationship, and that we didn't want to create unintentionally some barriers to trust and to working together. So you need to take your time sometimes to work through those potential implications with your stakeholders. It's also important not only to think about the financial and political implications of everybody working together, but what are the financial and political implications of the proposed change to key stakeholders? Could this potentially cause some economic damage to one or more of the groups? A local coalition that's been trying to remediate houses, our older housing stock, they've been looking for lead, particularly in the paint. They've been working to try to remediate it, kept trying to bring landlords to the table. And the landlords didn't want to be part of this because it was going to cost them money. And while they didn't want to open themselves up for liability if they're like, we didn't know it was there. We've owned this house forever. We've tried to do what we can. For them, it was a very much an economic piece. And while those of us in public health might be like, it's still the right thing, it's recognizing that this is, can be their livelihood, and this is economic, and it's real, and it's tangible. So how do we work with other partners then to think about, how do we minimize some of those costs, or how do we support low to no interest loans to help underwrite that? How do we do this policy wise? Can we do this in a way where everybody's together? Now, I will say in some of our communities, we never got landlords involved. And so then it became a policy change of, we're going to make you do it. It became more punitive than collaborative. But you just have to realize there's real financial and political implications to things that you might talk about to all of your key stakeholders. And then one of the most important is, what are the differences in power among the key stakeholders? And power can mean a whole lot of different things. It can mean the financial resources of the partner. So I work at a university, and when the university comes and partners with a community organization, there's a huge imbalance of power because the university has a whole lot of resources that it can share, and a community nonprofit doesn't. It's just going to be smaller, and it's not going to have the budget and the monetary resources and all the challenges that come with that. It can be a balance in power of who has the legal authority to make decisions, so that, you know, if your county commissioner is sitting at a table with a community member, that county commissioner has more power than a community member because that county commissioner can influence policy change. It can also be kind of traditional or historical professional standing in a community. I work with a bunch of physicians. Luckily, most of them are very aware of, just by having the title of physician, they kind of carry a certain power with them into different situations, and they try to be very aware of that dynamic, and understanding what that means when they're trying to partner with people on projects. But it's thinking about those power differentials and what can you do as a coalition to balance some of those out. So the how. Before you can put any kind of those frameworks or models into place that we talked about, your key stakeholders, you need to get people together and talk about how you're going to work together. You need to identify, is this going to be a formal partnership where we're like writing like all of our rules down, and this is how we're going to work together, we're going to have a set schedule, this is what we're going to do? Or is it more of an informal collaboration? Are we all just going to agree, yep, we're working towards the same thing, and we'll update each other from time to time? What are our different levels of membership and participation? In almost every coalition I've ever been a part of, some people are really involved in doing this almost every day, while others are like, let me know when you need me to do something. So what do those different levels look like? With that goes, what are the responsibilities of the partnership, of the collaboration, both the members to the partnership and the partnership back out to the members? How are we going to make decisions? Do we have like an advisory board or an elected board? Do we have an elected chair? Is it just consensus among all of us who happen to show up at a meeting? Is it just one person who's leading and the rest of us will go along with it? But what is that structure look like? Who are our leaders? How do we identify the leaders? And usually you want to have, even in an informal collaboration, there's going to be some coordinating individual or organization who's like, I'll be the point person. I'll be the person you can contact. Here's my email. You usually try to have somebody who could help to at least hopefully keep things going. In some of this, how, that question I just mentioned about power differentials, this is where a lot of that can show up. You know, thinking about who those leaders are and how do you provide opportunities for collaborators, for stakeholders who maybe are in a position of less power to be in a leadership role so they have more power in this coalition. This provides them with the opportunity to exercise a little bit more of that. Or how can they play a specific role in decision-making? Often decision-making and power comes down to who has the right to vote on something and who doesn't. And so that also gets into different levels of membership. So it's important to make sure that decisions don't just come down to the people who are providing the funding or to that background, that backbone organization. You need to think about how others can play a role. So I've used partnership, and I want to make sure I've defined it. A partnership is a relationship in which two or more entities, meaning individuals or organizations, enter into a formal agreement to work together for a common purpose or a shared goal. So again, it can include individuals, organizations, systems, programs, community groups. It can be local, state, regional, national level. But the key defining characteristic of a partnership is that there is a formal agreement to work together. Now, that formal agreement may be, you know, somebody who says, yep, I agree to volunteer, like they fill out a volunteer form and this is the role I'm volunteering for. As long as that form says you're agreeing to volunteer and you're going to participate in 4 meetings a year. That it doesn't have to be, a multi-page legal document. It can be fairly straightforward, but there has to be some sort of formal agreement to work together, as opposed to a coalition, which is kind of, I mean, I've been at meetings where I go to a coalition meeting and I go because I'm interested and I want to learn from it and I want to see what they're doing, but that going to coalition meetings doesn't commit me to a specific role. I'm not a partner because I haven't agreed formally to working towards a goal or to a shared purpose with that group. So there's different levels. And this goes back to that membership question. And so I kind of can't emphasize this enough because I've seen it not go well. And so to me, this is really important. It's important to be clear about your criteria for membership in whatever coalition partnership you're putting together. Your criteria should reflect the program goals, your intended function and your intended functions, and larger partnership goals. So if, you're in a group, like I said, the group that was advocating for moving the bus stop, they had a very specific goal, and the criteria was pretty much that you supported that goal. So you could be part of a coalition and you were gonna commit yourself. This was the formal agreement. Everybody who was kind of on their mailing list committed to contacting at least one decision maker. And once you did that, you were continued on your mailing list. But it was clear, like, this is what we're trying to do. This is our goal, both for our, this intervention as well as our larger partnership. And this is the function. This is what we're trying to do. Selection of members, it can be an iterative process, and it usually is. Usually you start with a group, and of that group, you've got people who are like, yeah, this isn't really a priority for us, so they step back. Or they say, it's not a priority for us, but I know this group over here, and they're really interested in it, so I'm going to get you in touch with their key person. You'll have some people going, our organization would like to do this, but I'm not the best person, so they connect you with somebody else. So it becomes this process over time. Or as you develop a specific goal, they might go, oh, I know somebody else who would be interested in this part of what we're doing. And so they bring in somebody else. So you really want to think about how current members can identify future members. How do you recruit those individuals into the work that you're doing? How do you engage them? How do you orient them to the goals of your partnership or your collaboration? It's important to have a diversity in members kind of across the board on every aspect you could think of. Expertise, reputation, interest, their community ties and connections, their capacity. I don't know about you guys, it feels like when we're building coalitions, our first instinct around here is to think of the same like 10 people. Like they're the ones that you always see around the table and you ask to everything because, they're great, maternal health experts, but they're generalists and they've got 20 other projects on their plate. They can't do it. They have no capacity. So thinking about who might be great at the table, who has a little bit more capacity to do some of the work, who has that knowledge, who can be your experts, and just find that diversity and that balance across the board. And there are some essential members that are going to make or break your success, and included some of those key informants, those key stakeholders in your community, those opinion leaders, and those gatekeepers, those community members. You really have to have them involved for a community-based intervention to be successful. And it's also important to realize that you can have members at all of these different levels. So the largest group of your members can be those that you inform of what's going on. It may, those are the ones that you say, hey, everybody, there's a community meeting on where this bus stop is moving. It's going to be Thursday night at 6:30 here at this community center. Come and join us. That's informing. Then there's the subgroup that you're consulting. They're the ones that you're reaching out to. They're the ones that you're asking questions of. They're your experts who can give you feedback on what a community will accept or not, on a successful way to advocate with local policymakers, on here's what the transportation board is looking at, all the things they have to consider when they're moving a bus stop, so that you're ready and you're informed and prepared. Then you have those that are involved, that are doing some of the work, that are engaged more consistently, doing a little bit more than just consulting and giving you feedback, like they're actively helping you to implement plans, um, and engage others in activities. And then there are those that are your collaborators that that are really empowered to be leaders, that are really actively, regularly engaged, that are saying to you, I think we should do it this way. You know, they've taken on those leadership roles, they're taking on those spokesperson roles, and that's your smallest subgroup. It's fully expected to have members across all of these different levels of a partnership. And so, and ideally you have a good balance of this. And people can move in and out of those levels over time, depending on how your coalition goals change, how their capacity changes. So it's good to have some flexibility for individuals within your structure. Collaborative and partnership agreements. I want to make sure I talked a little bit about this with partnerships, but they're formal agreements that allow for mutual accountability and defined roles and responsibilities. So like I said before, it could be a volunteer application of, yep, I agree to volunteer and I will come to quarterly meetings. And I understand that if I do not attend the quarterly meetings, I may not be asked to serve in this volunteer capacity next year. It can be that simple, but it needs to provide, there needs to be, whether in that one formal agreement or in kind of rules or documents that are prepared by your coalition, there needs to be information about, you know, how do you minimize potential disagreements? So what's our decision-making process? How do we handle when we don't reach consensus? Some sort of orientation to some of those things. You need to be able to describe your goals and your deliverables. What are we all working towards? What's our leadership? How are we sharing resources? What resources are we sharing? And kind of define that reporting and dissemination expectations. So again, going back to even that simple agreement, it can be like, I agree to serve. I'll come to 4 meetings a year. I understand, you know, I've read through the goals of the coalition and I agree to support that through my expertise when I'm at the meetings. It can be that simple. The important thing is, especially if you have more complicated agreements, and especially if there's funding involved, right? You want to make sure that any partner, if they're going to be signing a formal agreement, that you give them plenty of time to look over any agreement, that you're not rushing them, that you know, you don't have them at the table and go, oh, by the way, we need you to sign this document while you're here today, because we need it for whatever reason. You don't want to pressure anybody to do that. And it's really important when you have this power differential of, you know, like a governmental, you know, local health department, that you've got this grant and you've got this money and you've got all of this, you've got all these staff people, and then you've got a community partner that's like a community coalition or a community organization that's got one half-time paid person, everybody else is a volunteer, and they have a very minimal budget for the year. And you're going, hey, we want you to be a partner in this, and we've got some grant money that we can shift your way, but I need you to sign this right now so I can do this. You need to be aware of those power dynamics and make sure that you're respectful of that partner and you're providing them with plenty of time. There's different structures to partnerships and collaborations, and I'm going to go through some of them, just 4 of them real quick. They all have different roles. I think I've served on all 4 at some point in time. So if you have questions at the end, I can answer. And I'm sure all of you have seen these participate in these, will be familiar with them. An advisory board or committee really can serve multiple functions. Quite often they're providing feedback on proposed ideas and interpretation of findings. If you're doing your community health assessment, these are the community partners you get around the table after you've done all the data analysis, and you say, here's what we're finding. What do you see as the main issues that we should focus on in our community health assessment? They can help you to identify community resources. So they can be really great around the table. If, you know, you've got everybody around and you're talking about your community health assessment, and they might go, hey, I'm glad you identified this as a problem. That group over there is also working on it, and they just got a HUD grant to work on housing. So you might want to contact them. So it can really be helpful when you've got an advisory board, especially if you've got some well-connected people in the community who know a whole lot of people, who often are those gatekeepers or opinion leaders. They'll know about things going on in the community that you never would have even known existed if you didn't have them at that table, and it provides you an opportunity to network. Advisory boards and committees can also review existing policies and recommend changes. So they might be able to tell you, okay, I know this is how you wanted this policy to function, or this was the goal of the policy. How it's really working in real life is, and they can share with you where some of the glitches are in a policy and give you that feedback and help you to achieve some different outcomes. And then they can provide input to the decision makers. So you know, they can be great advocates for you, especially when it comes to policy change. I saw Hope ask, is it a best practice to compensate advisory board members? So not necessarily. I think it's always nice to be able to do something for advisory board members, but sometimes that can be just like have some cookies at the meeting, or you know, acknowledge them sometimes in the community and thank them for their service. It's sometimes just an acknowledgement. The biggest thing when you're talking advisory board is you want to be consistent. So you don't want to provide something for one that you can't provide for all, because that can create a bit of a power differential. One of the things that's been most successful with some community-based research projects that we've done is making sure that we're providing like boxed meals, especially if we're trying to get parents to come. And we always have extras because we want them to be able to take them home if they need to for their kids. So we try to provide things that everybody can benefit from, but can mean a difference especially if we've got parents and they're like, I'm missing a meal, or they've got a kid with them. Like, we try to be flexible and make sure that we're doing something that helps to support them being involved. So I hope that answers the question. Okay. A task force is different because task forces are typically charged with a specific issue or priority, and it's action oriented. So these sometimes are also ad hoc committees to like a larger board, but they tend to be either time limited or they're limited until they reach a specific outcome. They're often established, so it's usually the larger coalition says we need a subgroup to work on this piece. And that's what that task force is. So it's still important to have people, and people who are on the task force don't necessarily have to be the same people who are involved in the coalition. You can bring in some different people to achieve the specific goals of the task force. But the defining characteristic of a task force is it's either very time limited and issue limited. Again, we talked about coalitions can be really broad. It's usually a formal alliance of some kind of organizations to work together with a defined leadership structure. People are going to pool resources, whatever resources means. It can be expertise, it can be money, it can be space, it can be whatever, but it's some sort of resource with a clearly identified goal or desired outcome. You have different levels of engagement possible, but there is a communication structure. So coalitions are like the big, massive groups of people quite often. And typically coalitions are not individuals. Coalitions are organizations, and it's key individuals in those organizations who serve in the leadership structure. Often with coalitions, you will have in that leadership structure, seats at that leadership structure are identified for specific members of the coalition. So it may be that you have a coalition of the universities in your state, and each university gets a seat. That would be perfectly fine. But it tends to be a larger organizational base instead of an individual base. And then with an executive board or committee, this is a formal group, defined membership that represents the stakeholders who provide oversight to activities of a larger group. And they might be elected, they might be appointed, but there's typically a process involved for people coming on and off the executive board or executive committee. The terms are established, their roles are established, and what they're expected to do is established. So the most common example of this is Any professional association has an executive board or committee, and they have defined roles and defined expectations and defined terms. So I want to talk through some strategies for collaborations and partnerships. First, it's important you have a shared vision because you need to define the why for everybody who's part of the coalition or partnership. They need to know why they're sitting at the table. Everybody's busy. Everybody's got a million things they could be doing with their time. So you need to make it important and be clear about the why of why they're taking time to be in this collaboration or partnership. There needs to be a shared aspiration. So it's important to have a shared vision. Like we're all working toward, all of our communities not having lead in residential buildings anymore. That would be a great vision. It would be great to not have to worry about kids being exposed to lead because of where they live. It should be specific and measurable enough so where you can demonstrate project progress, but broad enough to encompass multiple priorities. And your vision should be developed through group techniques. So, been through it many times in strategic planning, coming up with a mission and a vision statement, but having a vision does help to bring people together. And gives an opportunity for them to understand how maybe the specific missions of their organizations fits within this larger vision. Make sure you include multiple perspectives. It is so easy to go back to some of the same people or the people we know we agree with to do the work. Like it's easy and it feels like, okay, well, we don't have to do all this other stuff because we already all agree on this. But it's important to have different and multiple perspectives around the table. And you need to be deliberate in creating an environment for all stakeholders to share freely. Because while you all might have a shared vision, you might have very different ideas of how to get to that vision. And you've all had very different experiences so far trying to address this topic. And so creating an environment where people can say, that really didn't work for my community. I know you have an evidence-based model and you think it's perfect, but I'm telling you, in my community, this won't work. You need to be able to listen to that. And that stakeholder needs to be able to say that freely and openly without fear of retribution. It's important to set expectations that you all support innovation. You all support thinking differently from each other, that's a growth mindset and that's an expectation for your collaboration or partnership. And that you set aside plenty of time for brainstorming and sharing with each other. Too often, meetings around coalitions and partnerships, it can become, over time as you get into that maintaining phase, it can become a lot of reporting. Well, we did this, we did this, we did this. Here's the data. Okay, let's go back and keep doing what we're doing. Instead of setting aside some time to really dig into some of those results and ask about, well, how did that work? And what were the barriers you ran into? Or how do you think it could go differently if you tried this? Or have you made any adjustments to the program in the last few months? Like really thinking and asking each other hard questions to keep moving forward. And it is important to allow for a process that's fluid and dynamic. We all like to know what to expect. And sometimes that kind of fluidity can be a challenge for people in a partnership, especially if you haven't built the trust. But you need to allow for it not to be the same old meeting that it always is. Along with multiple perspectives, make sure that there are some clear and constructive ways and expectations about how you'll deal with differences and conflicts. Recognize, again, and I've talked about the power differences, I can't talk about them enough because I have been involved where those weren't acknowledged. They were kind of the elephant in the room, and it makes things really difficult, and it ultimately leads to a coalition not being successful. So recognizing those multiple relationships and the power differences among stakeholders. Make sure you've got a way to share decision-making among the group, to share that power in the group. So even if there's a power differential when you all leave your meeting, when you all leave the room, in that coalition, think of different ways to share power to balance that out. Make sure that you've clearly defined expectations and responsibilities, so that it's not somebody feeling like everything's put upon them or they're treated differently than others. Make the expectations and responsibilities for everybody in particular roles or who take on particular roles consistent and clear. And then create pathways for stakeholders who might prefer or need more informal agreements. Not every organization is going to be in a position to sign on to a formal agreement, but they might still support what you're trying to do. So think about how can they still engage and support, even if they're not part of that formal partnership structure. How can we still communicate with them? How can we share our goals? How can we engage them in some of our activities? Depending on what you're building a coalition or a partnership around, that can be hard. But it's valuable to at least think about ways to engage different people in different ways. It's really important that you discuss past strategies and approaches in a community as you're building these collaborations and partnerships, and to be honest about what's been tried, both by the community and in the community by others, to address this issue. Talk about the positive, what's worked, because that's a great asset. If something's been tried before and you know there was some success, that's something to build off of. But you have to be honest about the negative experiences. And that can lead to some really challenging conversations. But it's really important. And it leads to the really good stuff, but you have to be comfortable doing it. Review evidence-based or evidence-informed programs. Talk about how these might work for your community. But we all know that there's limits and some of that evidence-based and evidence-informed. So always look at those through the lens of, will this work for our community, and or what change would we need to make for it to work in our community based on what's been tried and worked or didn't work in the past. And recognize the experience of community members and organizations serving communities, recognize their expertise, both in trying to understand the issue of concern, but also other challenges, getting to those root causes. You are all public health experts, and that is critical and valuable, but you need to recognize their expertise as being part of this community and what they've seen tried, what they've been part of, what's worked and what hasn't. Collaborative leadership is really important when we're talking about partnerships. And by that, we mean leadership is shared across the community. That improves buy-in. It helps facilitate participation across the broader community. It helps in the implementation of activities. It also shares the work. I don't know anybody in public health that's like, I got plenty of time to take this all on by myself. We all have lots of things that we want to do, that we need to do, that we're expected to do. And so do a lot of our partner organizations and individuals, whether they're volunteer organizations, other governmental agencies, even academic partners, like we're all busy. So having a collaborative leadership structure helps to spread out the work. It helps to make it a little bit more manageable for people to be involved. It might not feel like, oh, I got to be the chair, so I'm responsible for all of this. But maybe if there's like 3 co-chairs and you can divvy up the work, that's a little bit easier to engage somebody. You do need to have that backbone organization, but the backbone organization doesn't necessarily need to have the leadership role. In fact, often it works really well if the backbone organization doesn't have a leadership role, because that can affect the power dynamic. And it helps to build multiple relationships, making sure activities are aligned. It can mobilize funding, coordinate all the data collection, but then it can support all of the leaders equally, equivalently, and make sure that leadership feels fully supported, instead of maybe thinking, well, they're going to only support the leader that's from their organization. Open and clear communications, and communication is such a tough and challenging issue. When it comes to partnerships, active listening should be an expectation from all members during all activities. And it's really important to have a communication plan that lays out what the expectations are for communications, both from that backbone organization, but also how do members talk to each other or report things to the backbone organization to share with others. Have a timeline. So like every 2 weeks, we're going to do this, or monthly, we're going to do this, or, how are we going to communicate? What are the expectations as far as respect and frequency of communications among individuals in the organization, and what methods are most accessible to stakeholders. And this has changed so much and so rapidly over what feels like a very short period of time, but it's really important to identify, are we going to communicate, by email, by text, by phone? Are we going to set up some sort of cloud-based system? Like, how are we going to communicate in a way that all of our members can engage? And you need to make sure you have shared accountability. You have to be accountable to each other for a partnership to work, especially long term. What are your measures of success? both for the partnership in general and then towards the goal that you're trying to reach. I always advocate for SMART objectives. I think, they're a great way to get everybody on the same page. Um, Create a logic model that shows who's going to be responsible for activities and how progress will be reported and reviewed. So show how we're going to do this, which will lead to this, and then this is our ultimate outcome. Like show how activities relate to the goal of the partnership. And make sure that data on your progress on activities is available to all the stakeholders. So you want to be as transparent as you can be. Establish timelines for the review of data to make sure that you're making changes to assure the success of an approach. It is really important to not wait until like the end of a grant period or the end of something to do the evaluation. Try to schedule interim evaluations as you go, just to show that you're monitoring the activities that are going on. Okay. So we're going to do some practice questions. Ashley, do we have polls? I think we have a poll set up, right?
Yes, we do.
Okay.
So I'll leave the polls open for like 45 seconds. So once we launch them, and then I'll close them and share this result so you can share, like go over it with everyone.
Awesome. Thank you. So the first question, which of the following describes the process of working with and through groups of people in partnerships and coalitions that mobilize resources and influences systems to address their well-being? So collaboration is the best answer for that one. And just because collaboration really is a process of working across people and groups, like you're just working with larger, it's the more broad term. With the idea of mobilizing resources and influencing system. Community engagement, constituency development, and community action are all more narrow definitions than collaboration, which is this broad term. Community action is really around a mobilizing towards a specific goal. Like we're all going to work together on this. Constituency development is building a group of support. So we're going to bring together a whole bunch of parents to support vaccination for our students before they enter schools. And community engagement is really that process of building the relationships with the community so you can do some of these things, but it's how do we work with our community, how do we build that trust, and then work with them to identify what needs to happen. So those are all kind of subsets of collaboration, whereas collaboration is the term for this larger process of working with and through groups of people. Okay, I think that was the hardest one. So question number 2. A multi-state regional coalition is in place to identify successful state-level strategies for enhancing healthcare and community services for children with special health needs. The coalition membership currently includes healthcare professionals and representatives from state departments of public health, housing, education, Medicaid, and social services. There's one remaining seat. Which of the following representatives would be most appropriate to fill the open slot?
I'll leave this one a little bit longer just because of all the reading.
Thank you. Good job. A member of a parent advocacy group would be amazing for that last open seat, because you want somebody that is as close as possible to the population to be served. And the population that they're seeking to serve are children with special health needs. Now, I would argue a principal would be nice, but you already have somebody from the State Department of Education. So you have somebody with some familiarity of what's going on in our schools, and you already have some healthcare professionals. So a pharmacist and a pediatric cardiologist probably would just add to that list, instead of getting a different voice, getting a diversity of experience around the table, which would be a member of a parent advocacy group. I should have highlighted that. Question 3. A community recently completed a community health needs assessment. The process included a diverse set of community partners who identified 9 priority issues. The steering committee decided that the list should be narrowed to no more than 4 issues. Which of the following processes should be used to prioritize the identified community needs? All right, you guys did well. So the best process, the best of these choices, is invite everyone who participated in the community meeting so that they can hear what the steering committee has decided, and then they can vote on the priorities and get the list of 4 from there. It doesn't mean as part of that presentation of the priorities, you can't talk to the local funding agencies, because that's important data for all of the stakeholders to hear. And members of the steering committee can come to that meeting as well and rank their priorities along with everybody else. But this way you have everybody who's been engaged and involved part of narrowing down that list, and you get a diversity of opinions. So hopefully you're going to make a choice of the 4 that's going to have the most appeal across your community. Question number 4. Community public health goals and objectives are best developed by which of the following? So the answer is B. Ideally, you want to have, again, the people who are affected by what you're trying to address, the people who are actually living in the community that you're seeking to serve. You want those individuals developing your goals and objectives. Now, it doesn't mean that medical professionals shouldn't have a seat at the table, that public health professionals obviously have data and kind of have some more big picture, can't help to inform that either. But it's really important to make sure that community members are leading the efforts to identify what the goals and objectives should be in a community, because that's where they're living, whether it's a physical location or a community defined by an ethnic background, a religious background, that's still where they're living every day and they know the needs the best. Okay. Question 5. To ensure successful collaboration and partnership, as well as effective use of resources, a public health professional needs to identify key stakeholders in a new project. Which of the following will determine if an organization is truly one of the key stakeholders for this initiative? Yep. So the answer is C, that you can identify, the public health professional can identify what is needed from that organization. It's great if you have a working relationship from before. It's great if that relationship is kind of static and steady, but you shouldn't just have people around the table that you know, and because you like working with them. It should be that the organizations and the people around the table, you can say, this is why I need you to be part of this partnership or collaboration. Okay, so Q&A, and I saw there was already one about the responsibilities, a question about summarizing the responsibilities of a backbone organization. So the backbone organization is the one that's going to support really the day-to-day tasks of a collaboration or a partnership. They might be the email address for the organization. So they help to support the communications, or back when you used to have an office phone number that people could call with questions, they would be the phone number. They would serve as the one who could answer those questions if somebody needed to call. They can be press contacts if you're doing some communications and engaging the press. They can serve as the funding agency, so the fiduciary. So if your partnership or coalition is seeking some grant funding or some external funding, this is the organization that is able to accept the money and then make the appropriate reports to the funding agencies that need to happen. So it's really kind of that administrative support. How that looks from partnership to partnership can vary depending on really how the different types of organizations that are included, or the different types of individuals included. But you want to make sure that the backbone organization is able to use some of those like day-to-day administrative tasks. Did that answer? Hopefully that answered. Any other questions that I can try to answer? Okay.
So if you have any questions, make sure you're putting them in the chat or the Q&A. I saw someone raise their hand, but if you could do that, that would be great.
So these might be more questions for you, actually.
Yes. So no, not all the questions on the exam are situational. There's different levels of cognitive levels that we're testing. And so some are situational, some are recall. Again, if you have a chance, go to the website and take one of the practice tests. That's probably going to give you the best idea of what kind of questions there will be. Those are all questions that are retired questions. So they previously were on exams. They're no longer on exams, but it gives you a good idea of what is on the exam.
And I will say I picked some of the situational ones just because I think that gives some opportunities to either raise some questions for all of you, or I think they can be a little bit harder. So I try to share them as a way to practice, but.
And then another question is about scores. We won't, because we changed over the content outline. Scores won't be available right away this August, and I don't have an exact date, but I expect in fall that they will be available once we have enough people that have taken the exam, so we can update the cut scores. There is a question here in the chat for you, Molly, about question 4.
Go back. So the question is, do you have a way to figure out if a question is best to focus on the data collection or the community? So I think it's always best to have members of the community, if nothing else, helping you with the interpretation of the data. So it's a massive asset for health departments. And I think a lot of people in the community don't necessarily know all the data that public health has that can help them to define the problems they're seeing in their community. But sometimes the data doesn't give you the full story. And so I always think that the best answer is to have some community members, some of those key stakeholders who can sit down with the data with you and help give you some context. Maybe help you to figure out where the focus is, or maybe some additional analysis, some additional questions to look at. So I always think for number 4 that members of the community who understand community needs are the best to develop, but it doesn't mean that the data isn't an important piece of information that they need to help them to do that, if that makes sense. Okay.
And then Mita, about the study guide book, I think you're referring to one of the study guide books available. NBPHE itself does not publish that. You'd have to go to the publisher and make those comments, because they are revising it and updating it too. Someone asked, would it be a good idea to take the exam in August before it would change? There would be a lot of, and will there be a lot of changes expected? I read that they're offering some reimbursements if we take the exam in August. So let me, so now that the content outline has changed, August 1st, the new exam, the exam won't change. Like what is out there for the exam now, August 1st, after August 1st, will be the exam out there until we publish that there's a new update in a few years. We have to update the exam every roughly 5 years to make sure that we're staying on top of and staying current with what is happening in public health, and that is the reasons for the updates. And as far as the exam itself, I wouldn't say there's been, this exam change was more of a just reorganization, more than a actual like major update and different content changes. I'm sure Molly, who has been a presenter in past times, updating her content, noticed that she could reuse a lot of the content in her sections. And so it's also not that major of a change. So if you have things like the APHE study guide, if our practice tests are now updated, but if you take the practice test, you'll see there are a lot of questions that we were able to reuse. So if you've been studying for a while and you feel nervous about the new update, there's quite a bit of overlap from what it was before. So I wouldn't worry too much about there being too much major new content. And I definitely understand the one person who said epi scares them the most. I hear that a lot.
When I took the exam 9 years ago, Epi and biostatistics at the time were to get, Epi and biostats was what I crammed more than I did anything else. So I completely understand.
Right. Any more questions? If not, we still have 3 more sessions left. So, our next session is next Tuesday for law and ethics. So, if I don't see any more questions right now, I just want to say thank you all for being here. A special thank you to Molly, for a wonderful presentation. And I look forward to seeing everyone else next Tuesday. Have a great day.
Thanks, everyone.